Welcome everybody to today's webinar. It's great to have you join us wherever you are in the world, particularly at this time of COVID where there are many distractions. But we appreciate you making the time to participate today, and also to those of you who we know will watch this on delay. We're very privileged today as we start framing up the next stage of the webinar series, which commences in May, where we're going to start to look at a more diverse range of veterans in our women veterans, our minority veterans, and our Indigenous veterans. And we're very privileged today to have Emma Moore join us from the Centre for New American Security. Emma has been working with some of her colleagues on what I would say is probably a small scale but initial study looking at this population. Emma, you might describe it slightly differently, but anyway, what it does for us, and we're very privileged to have Emma come and share with us today, it gives us a very quick overview, I think, of some of the issues and some of the themes that as a collective group of people working in this area that we maybe need to start to think about as we come into perhaps a more detailed look at some of these people who make up this population. Now, you will all have received Emma's bio in your info packs, but just quickly, Emma is a research associate in Military Veterans and Society program at the Centre for New American Society. And CNAS is a Washington-based independent bipartisan non-profit organisation, and that engages with policymakers and experts and the public around innovative fact-based research, ideas and analysis to shape and elevate national security debate issues. So Emma has a background of a Master of Arts in War Studies at King's College London and a Bachelor of Arts in International Relations from Brown University. And where at university she worked on their project on the cost of war. Emma, it's great to have you with us today, and we look forward to hearing what you're going to share with us now.
Well, thanks so much, Robert, for having me. It's really good to participate in this kind of cross-national discussion with close allies. As you know, I've had the chance to kind of come down to Australia as well and see how you are all supporting your veterans. So this is our kind of contribution to the discussion on supporting minority veterans in the United States. And yes, that's small scale in the sense that we only looked at New York State in specifically, but as you will see, we did have some other findings. I'm personally really excited to do this work. We spent a good amount of time working on veteran outcomes broadly, and we set out on this project to understand what, if any, disparities existed and identify recommendations to improve outcomes. This work gave us an opportunity to dig into those questions in New York State with results that are also relevant nationwide. And now, while this report is focused on outcomes in the United States, the framework and approach can serve as a guide or framework for work and research in other states or countries. So first, I'll talk about the framework we used to conduct the research, to give some demographic context that undergird the results, and explore our findings, followed by our recommendations for a variety of actors. In the United States, members of the military are drawn from every corner of the nation. They serve in a wide array of jobs across the different branches of service for varying lengths of time. And then, of course, they transition back into civilian life across the country. This research disaggregates the overall veteran population to explore whether outcomes across several life domains vary for women, racial ethnic minority, and LGBT veterans. The research was conducted upon request from the New York State Health Foundation. As you mentioned, we are a nonprofit, so we do projects that are funded from outside support, and they are more focused on the health of post 9/11 veterans in New York State. However, this research often takes a more expansive lens for a number of reasons. And it builds off of 4 past regional needs assessments that CNAS has conducted across the United States. and seeks to fill gaps in existing literature by first determining what, if any, differences exist between outcomes for minority veterans versus non-minority veterans, as well as between minority veterans and their minority veteran counterparts, or their minority counterparts who have not served in the military. It identifies likely causes for these variations and then developed a series of recommendations for organizations that serve veterans to enhance equitable outcomes across the population. So we really tried to look at this broadly and cross-cuttingly. So I'll first go over the framework that we used. This research uses a slightly modified version of a holistic model that was developed by RAND Corporation based off of earlier work at CNAS that includes 4 life domains that affect veterans in transition and beyond. So the holistic model of interrelationships and intervention opportunities looks at health, housing stability, financial stability, and social support or functioning. Each of these domains are interconnected. Poor health can harm your financial stability can lead to housing instability, and inadequate social support is linked to poor health outcomes, and so forth. So in addition, each of these can be influenced by services and interventions. And we looked at each cut of the minority subpopulations, so again, that's women, racial, ethnic minorities, and LGBT, across these life domains. There are a couple other notes just to consider. We thought this framework was really important because it aligns with growing recognition of the importance of social determinants of health. So, of course, the circumstances and environments in which individuals live, work, grow, and age that also impact their well-being. For instance, the lack of accessibility to healthy food options or the presence of household asbestos both negatively impact individuals' health. Chronic social stressors, such as being subjected to racism, sexism, homophobia, poverty, or cultural dislocation, are known to cause negative outcomes, which is known as minority stress. So we recognize that intersectionality, in which folks can occupy multiple minority statuses simultaneously, is very important. And when possible, we tried to use an intersectional approach. However, data and space limitations in this report made it impossible to do so comprehensively. As you probably all understand as researchers, the permutations eventually just become so small. So this is definitely an area ripe for further research. Data limitations also forced us to take a more expansive approach in terms of era of service. So while looking at subpopulations in the veteran community, sample sizes quickly became too small to be meaningful. We followed a mixed methods approach, and this project synthesized 3 sources of information. The first, a literature review of existing literature and publicly available data. The interviews with key stakeholders at the national and New York State level, and then focus groups with veterans who live in New York State. To reach out to veterans and hold these focus groups, we found that outreach to underrepresented veterans comes with additional barriers and considerations that require more effort and time to actually reach those individuals. We had particularly difficulty conducting outreach in rural areas, which New York State is rural outside of New York City, where many veteran service organizations, their posts and other groups were non-responsive. So we attempted to supplement those with site visits in those areas. And to overcome challenges for outreach in New York City, we worked with the New York City Veterans Alliance to conduct social media outreach, and an advocate named Pam Campos to conduct outreach to individuals and organizations. We found that examples of trust building and ensuring messengers of information and invitations are trusted, representative community leaders, that they come from non-veteran specific institutions as well, so colleges and universities, and carving out capacity for one-on-one discussions with interested participants who hold questions or suspicion was very helpful for actually getting veterans in the door and participating in these conversations. So we'll go over some context. The notional image of what a veteran looks like that usually springs to mind for many Americans, and this holds true for many of our partners around the world, is that of an older white man. And in 2017, men made up roughly 90% of the veteran population. And of them, 78% were white with the median age of 65. whereas the post 9/11 veteran cohort has a higher percentage of minorities than previous service eras. And this is a trend that will only grow in keeping with United States demographics writ large. Due to the urban-rural population dichotomy and the reality of New York State, the majority of veterans live in and around the greater New York City metropolitan area. However, the highest concentration of the New York State veteran population is located in upstate counties. Those are Hamilton County and Jefferson County, which might not resonate as much, but those are highly rural, closer to Canada, and those veterans tend to be older and less diverse. Given the female participation in the military had grown substantially after 1973, women veterans skew younger than men veterans and have a median age of 51 compared to 65. And by 2017, women made up 17.5% of the military, which was up from 15% in 2000. That progress is slow but steady. The percent of women veterans will grow in coming decades as the number of men veterans declines precipitously, but men still make up 90% of the veteran population today. However, and we can see that the breakdown of ethnicity on this slide, veterans overall are less diverse than the civilian population. And this is the United States at large, not just New York State. About a quarter, 23% of the overall veteran population identified as non-white compared to 38% of our civilian population, 11% identified as Black, and 8% as Hispanic. As you can see here, women veterans are more diverse than men. 65.2% identify as white compared to 78% of men veterans. And this is largely a factor of age. The post 9/11 cohort is significantly more racially and ethnically diverse. And in New York specifically, we saw or found that 21% of New York State veterans were racial and ethnic minorities in 2015. That's 11% Black and 8% Hispanic, and that's expected to rise to 37% by 2040. So quite a large jump. The New York City veteran population is much more diverse than the rest of the state, identifying as 41% non-white veterans, of which 30% is Black. We struggled with finding data and information on LGBT veterans. There is no longitudinal data available on the prevalence of LGBT troops or veterans due to the legacy of our Don't Ask, Don't Tell policy that was rescinded in 2011. And according to the 2015 Health-Related Behaviors Survey of the active duty population, which is the most updated and comprehensive data available, 5.8% of respondents to HRBS identified as LGB, 1.9% of men identified as gay, and 2% as bisexual, whereas 7% of women identified as lesbian, and 9.1% as bisexual, and 0.6% identified as transgender. Now, we can generally assume that rates are roughly similar in the veteran population, and the VA's estimate about 1 million LGB veterans nationwide is in line with those estimates. The estimates for the number of transgender veterans range from about 134 to 163,000. So kind of having covered the broad context of the veteran population nationwide and in New York State, we'll delve into the findings that CNAS had about how minority veterans are faring. Just a quick note, the full report is accessible online at cnas.org. I won't have time to go over every single outcome, and I'll just focus on some highlights across the 4 domains, and largely on the national level rather than New York specific due to data available. So overall, veterans in the United States, because of our insurance and healthcare system, they have access to better and more consistent care than their civilian counterparts. However, veterans experience different risk factors and health outcomes than civilians. The VA's Office of Health Equity has not released actual data on minority veteran health outcomes, which is expected later this year. African American focus group participants did express beliefs that they encounter similar barriers within VA and are reported in the civilian sector, in terms of providers taking concerns less seriously and lacking cultural competence. It was kind of a theme throughout these conversations in the healthcare space. We heard in varying forms a number of times that from focus group participants in New York that the VA and others have found previously that women veterans do not always feel welcome at VA facilities, let alone other veteran-focused groups and spaces. Looking at women veterans in particular, the overall health experiences and outcomes for military-affiliated women have been decreasing over the last 15 years, which include both physical and mental health challenges and conditions. We know that military women disproportionately experience musculoskeletal injuries as well as sexual trauma. In 2018, 6.2% of active duty women and 0.7% of men experienced past year sexual assault. 24.2% of women and 6.3% of men had experienced sexual harassment in the past year, and 16% of women and 2.3% of men had experienced gender discrimination. So comparatively in the nationwide civilian population, over the course of a lifetime, an estimated 27.5% of women and 11% of men experience unwanted sexual contact. So women veterans may have complex trauma histories. And these women veterans do not necessarily trust VA, though usage overall has continued to climb. And that references the previous slide. Another issue is that under VA's medical benefits package, women vets cannot get abortions or abortion counseling, and there are no exceptions, unlike under private insurance, where they may be charged with copayment for birth control. So there are a number of discrepancies when it comes to support for women veterans in the VA healthcare system. We also heard time and again that lack of adequate childcare is an issue across life domains, and it can harm efforts both to maintain employment and access to healthcare. This rang true particularly for the women veterans we spoke with. We picked up on our site visits quite a lot of pamphlets and paperwork. These are some examples, and it varies widely throughout New York State and VA medical centers themselves. We found that discharge status may have an outsized impact on LGBT veterans, since individuals kicked out under the Don't Ask, Don't Tell compromise may need to appeal their discharge status, if it was other than honorable or dishonorable, which can prohibit them from accessing needed healthcare and benefit options. Only 49% of VA medical centers are classified as leaders in 2019, as measured by the Health Equity Index that looks at and rates VA medical centers. 84 of the 170 centers were largely concentrated in the Northeast and California. And a common thread from the interviews and focus groups that we had was the importance of cultural competency and mandatory trainings for VA personnel who could then ideally better serve the LGBT veteran population. One concerning and damaging misconception that we have heard is that the VA does not offer any LGBT health services, which is not true. However, there are a number of services VA does not provide, such as gender confirmation surgery, which is also ineligible for other insurance plans for veterans who might be using different kinds of insurance. So additionally, IVF benefit is by default only available to couples in heterosexual marriages, because it does not allow the use of donor sperm or eggs or a surrogate. So you can see there are a couple of loopholes there that make certain populations feel less welcome and less able to participate in VA medical care. So we've heard that some LGBT veterans are not comfortable claiming their veteran status and are therefore less willing or likely to seek out VA healthcare. Others are unwilling to disclose their LGBT status to their healthcare providers due to the lingering aftermath of Don't Ask, Don't Tell. And this speaks to kind of the different service eras of veterans with whom we spoke. Or they're worried that they'll face harassment from fellow patients if they present in a gender non-conforming way. LGBT veterans experience disproportionate negative health outcomes, not because of their identity, but rather because of the stigma and discrimination they face for who they are, or due to providers that, quote, don't understand these implicit things they should about LGBT people. And this was just a common refrain, especially with every veteran we spoke with. But moving past health into financial stability, the next life domain, it summarizes veterans' overall well-being in terms of career, employment, and finances. And we included prominent factors such as educational attainment, income, wealth, and unemployment rates. Veteran unemployment is, well, prior to the COVID-19 epidemic, was 3.5%, which was lower than the general population's unemployment rate of 3.9%. And it seems that underemployment had been more significant of a challenge for veterans. Due to the economic implications of the public health crisis, we do expect this to change veteran outcomes when it comes to their economic attainment and unemployment status. There's been new research out just in the past week done by the Bob Woodruff Foundation that has shown that there will be cascading effects on the economy and veterans will be at risk for a number of reasons. However, at the time of this publication, on the whole, veterans had higher educational attainment and they out-earn non-veterans. However, these generally strong trends among veterans do mask differences among subpopulations. So looking at women veterans, we found that they have lower financial stability than men who have served, but higher financial stability than women who have not, across multiple measures, including rates of poverty and unemployment. Women have the lowest unemployment rate across groups, except for Asian American women, though this was a very small sample size and it does deserve a bit of an asterisk. And women veterans are more likely to be in the labor force than both male veterans and female non-veterans. So, disaggregating this data has proven quite interesting. Women veterans reported a lower median income than male veterans. For instance, median income for women veterans was in US dollars 35,517 compared to 40,995 for male veterans. That exceeded the women non-veterans median income of 24,653. However, it was similar to that of men non-veterans. So that's a lot of data, but the trend is often that women veterans do better than their civilian counterparts, civilian female counterparts, sometimes than their civilian male counterparts, but not quite as well as male veterans themselves. We also heard that job training is often focused on male-dominated industries and may be unappealing for women. Disability ratings also impact financial well-being. There are a number of complications to seeking out military sexual trauma disability and using it, for example. And there's a good deal more of that in the report. When it comes to education, one note is that due to military accession requirements in the United States, veterans are more likely to have at least a high school level degree than the general population. And overall, 23% of veterans versus 19% of non-veterans have completed some form of college. Women veterans are more likely to initiate and complete post-secondary education than their male counterparts as well, which makes that income gap a little bit more frustrating to look at. Now, this is, again, likely to change in the upcoming year, but minority veterans typically experience lower or equal unemployment rates than their non-veteran minority counterparts, but higher unemployment rates than white veterans. So there is an exception, such as Hispanic women are lower than white women, Asian American women veterans are higher than non-veterans, and other slight discrepancies. But overall, you see this difference. Structural trends throughout the United States may exacerbate unemployment moving forward as we dig ourselves out of the kind of economic slide and unemployment numbers that we've just seen here in the United States over the past couple weeks. But moving into LGBT is that data specific to this population and their financial outcomes is very under-researched, but likely follows similar patterns that we've seen with other minority groups. I'll switch over to housing instability, which connects to many other life domains such as employment, health, and social support, which are all made exponentially more difficult when housing is not secure. And since 2010, there has been a 49% drop in the number of homeless veterans. And that's been a huge effort from governors, mayors, and the charitable sector in the United States to really minimize the homeless veteran population and get them the support they need. The majority of homeless veterans are men, but women face particular challenges if homeless. African American and Hispanic veterans tend to be overrepresented among homeless veterans, and LGBT individuals also face challenges overcoming homelessness, and in many states, they are not legally protected against housing discrimination. We found some difficulties, with women who might be a primary caretaker and their inability to find beds in shelters, or for individuals who are gender nonconforming or are uncomfortable in large group bunk scenarios, that they face discrimination as well. Social functioning consists of familial relationships, peer support, and broader community support that includes marital status, parenthood, and engagement with or support from VSOs, which are the organizations that have chapters and posts throughout the country. Perceptions of veterans by colleagues, neighbors, and other actors in society can have a subtle but constant impact on veteran well-being. In the United States, we see an increasing divide in understanding between the public and the military community. Veterans often learn of benefits through participation in local VSOs and organizations in which women and other minority groups tend to be less likely to participate. So there's a skewed perspective there in support and awareness, just if they don't feel as comfortable participating in those spaces. Key findings in the social support section show generally that issues that pervade society, such as sexism, homophobia, transphobia, and racism, are also problems within the veteran community. And a key takeaway for us has been that individuals who want to see all veterans thrive must be willing to tackle those issues directly, both within traditional organizations and in society writ large. The typical cadre of veteran-focused support through veteran service organizations are not perceived to be widely supportive or welcoming to women or LGBT. And we have a couple of interesting stories of site visits to VSOs and VA facilities that, at least anecdotally, do confirm some of those experiences. So, having gone through quite a bevy of our findings, going into next steps, we wanted to look at specific recommendations that we had for those who serve and those who support veterans to reduce disparities and improve outreach. A primary set of our recommendations did focus on organizations that serve veterans, and among our recommendations are that organizations ensure diversity in leadership and in all of their materials, that they raise awareness about disparities and how their members can help alleviate them, and that they support efforts to support traditionally underserved populations. There's a lot of awareness to this, but a little bit less work being done in the space. Additionally, chapter-based organizations should work to ensure national level standards and values are being upheld at their local posts, where anecdotally and based on our site visits, as I said, that is not always the case. And this is only a section of all of our recommendations, which again are available online. We have another section, which are recommendations for the VA to enhance the experience of minority veterans, often by expanding or enhancing existing efforts or increasing accountability to ensure standards are being met. Now, that's kind of an overview of our report, which we have quite extensive details in the 39-page report online, but I blasted through a couple of our top line findings, and I'm happy to answer any questions.
Well, thank you very much, Emma, for that. And some interesting points there, I think. As I said in my intro, it's an area where, for many of us, we really, if we've talked about it, we haven't necessarily done a lot of work about those populations. So thank you for that overview. One of the things that you talked about, I'll kick off with, is that you used the looking at intersectionality as one of the tools, and you saw that as because of the constraints, you couldn't really put that to its full use. And you said you saw some opportunities in that process for the future. What sorts of things do you think are opportunities around that process for looking at this population or working with this part of the veteran population?
A good amount is making sure data is disaggregated when it is collected and then presented. Sometimes we ran into different groupings of veteran subpopulations. So if it's Asian is not necessarily a monolithic group identity, and similarly, there's sometimes a category on data representation that just says other minorities. And in New York State, for example, there is a sizable Native American population, which we did dig into a bit more in the report, and they did not cover in this presentation, but wanting to make sure that all states, in this case New York, have access to the information that in their state, and understanding where those intersections really do lie. So the first step for everything, especially as a researcher, is better data. Feels a little trite to say, but making sure it's disaggregated and collected in a consistent and comprehensive way.
Mm-hmm. You mentioned Indigenous veterans there, excuse me, and that as a non-US person, I was interested in the fact that you spoke about that in New York State there was a concentration. From the little bit you did with that population, and the reason I ask it because we're going to look at that subpopulation in a bit more detail in a couple of months. Were they reasonably consistent with the messages that came out when you looked at women, veterans, LGBTI, and other ethnic minorities, or were there some things that were a bit different?
The legal structure around the tribal structure and governance is a bit tricky in the United States in regards to their control of the land and then what they have access to. We did find that a lot of the information that pertained to more rural veterans certainly applied to the Native American population, and that's largely access to VA facilities and some complications around telehealth and telemedicine depending on where they were located. And especially as those veterans who are in more rural areas or have to drive a long way just for access to care, it can be very hard. There are also a couple of anecdotes about those legal complications when it came to VA care and not necessarily having a street address recognizable in the system and difficulty just really connecting the dots. The Native American population in the United States, there are a number of broader structural trends that impact the population writ large that also then filter down to the Native American veteran population. And when you asked about intersectionality and representation, one of the things that we would probably have liked to see is more information and data collection on that Native American population, which may be small but has in many cases an outsized negative health outcomes and other kinds of economic attainment.
One of the things that's interested me, and as we shape up that piece, is to discover that they tend to serve in the US military at a higher percentage rate of the population than the mainstream population, and which I found interesting. Yeah, thank you for that comment. We've received a couple of questions in on the chat stream, Emma. The first one was, in your research, did you identify any differences in outcome for minority veterans between the various services that they had served in, so Army, Navy, Air Force, Marines, Coast Guard, or was it reasonably homogeneous regardless of which arm of the service they had served in?
We did not look by service because we were already looking across life domains and across subpopulations. So adding service would have been would have lowered the numbers available even further, and it's actually quite hard in some cases to get that information. We had a bit of difficulty with kind of apples to oranges and data occasionally, just that it's not all represented in the same way or consistently. So, but we do see, the majority of folks, the Army has always been the biggest branch. So, and there are certain trends that we can see, and this is separate than the work that we did, of minority populations electing into service in particular branches, that we can probably look at some correlations, or at least it's certainly ripe for additional research.
Mm-hmm. Thanks for that. We've got another question here, and it is, how do you understand the interplay between ethnic, racial, gender, and the rurality? I mean that about the rural population among veterans. So that was the first part of the question. And the second part was, to what extent might this rural aspect, with its limited access to healthcare, drive the health disparities that you've described?
There, in New York State, and this, is slightly representative nationwide, there is usually larger numbers of veterans in metropolitan areas, and particularly in the New York City area, it has a huge number of veterans that do tend to be more diverse in terms of race and ethnicity as well as gender. And I think, I'm not remembering the particular percentage, but there's a higher concentration, and more rural veterans do tend to skew older and whiter. So it's disparities. Yes, the rural nature of the country has negative impacts on health outcomes, and the VA has tried to send out, has had a number of initiatives to try to rectify that, part of which are telemedicine, and others are mobile VA centers and things like that. It is certainly a challenge, although and in some cases that it does affect the outcomes for minority veterans, but due to the higher percentages of minority veterans in metropolitan areas, we found that cultural competency, as well as willingness to engage in the VA medical system, seemed to be more impactful for them.
You raised a point as an extension of that, was about the rural population tend to be more white and older. So in your work, when you looked at particularly that post 9/11 group, which you did share with us was more ethnically and racially and every other way diverse, did you notice how they were clustered? Did they tend to cluster more around, I guess in New York it's going to be the large New York City or the larger population centers, or were they reasonably diffuse across the whole across the whole geographic landscape?
Pertaining to New York State, certainly clustered in and around New York City, and that's where the majority of VA medical centers also exist. There are a number around in Metro New York City area, and fewer scattered upstate. And we traveled to Buffalo, New York, as well as Albany, in addition to New York City, to look at kind of the urban aspect and a number of counties outside for the rural. And it's a trend that holds throughout the United States in part, which is higher levels of poverty in rural areas and former manufacturing towns. So it's another one of those interplay, and we did the best we could, kind of going back to previous questions, with breaking out intersectionality and looking at these life domains, which certainly impact it. You know, once you kind of pull the thread, everything falls apart and you see everything is interconnected. So we did our best to look at things a bit siloed to make better sense of them. And we also see that older veterans have less access to transportation, and that's a huge concern for them, because then they can't even get to a medical appointment that they may need. Although particular to post 9/11 veterans, they do seem to be more concentrated around the New York City area, at least in the New York State context.
Mm-hmm. And going back to some of those other domains you talked about, is part of the reason you think they're clustered, coming out of your evidence, you talked about financial, job, employment, and some other aspects. Is that more associated with the fact that post 9/11 are still primarily in the workforce, and that causes them to cluster where jobs are, or again, were they, from an economic or a housing point of view or employment point of view, was that less important?
We didn't look or ask that in particular, although from past work, we do know that veterans tend to, when they leave the military, they either settle where they got out, or they go home. And New York City just being such a huge region, and where a number of recruits come from either the Long Island or greater New York area, that it brings in a ton of people, inclusive of veterans, for economic and lifestyle reasons.
Mm-hmm. Now, we've got another couple of questions here. This one is about VSOs. So our veteran support organisations, or in other countries might call that service organisations. So the question is, how do the traditional veteran service organisations differ from the newer organisations? So the older, more established organisations differ from the newer organisations that have been established, particularly in the last 10 to 15 years. And the question continues, if they do differ, is it related to the support they give to minority veteran community as a whole? So what did you observe there? I know you made the comment that you really didn't necessarily, my words, get a lot of support from them for your study. And there you made some observations about how minority veterans feel about them. So the question
Certainly.
is
So it's a bit of a push-pull question, right? In terms of, how well are VSOs pulling diverse set of veterans and younger veterans in, as well as are those veterans then opting into those spaces? And we have a bit of a breakdown in the report. Data does indicate that representation in traditional VSOs, such as the Legion, VFW, is lower, and that is in part, it seems, due to activities and desire of the younger veteran population to do different kinds of things and sit in a bar and drink, to be quite blunt about it. And so, yes, the newer organizations, and CNAS has done work kind of really looking at the health and future of the Sea of Goodwill space that does look at exactly this question. So the Mission Continues, or Team RWB, as well as Wounded Warrior Project, some of the newer organizations do tend to have a better gender and racial ethnic breakdown. Some of these organizations also do include civilians. So it does seem to be a different priority in terms of interaction with other veterans, or how the younger cohort wants to spend their time. However, VSOs can provide immense financial support and ensure veterans are getting the, connected to the care they need. So, they can still be incredibly valuable to the entirety of the veteran population. It does seem that first line of community, which is the posts and chapters, are not as attractive. So it is both. They're not doing a great job of pulling younger veterans in, and partially that is kind of an old guard perspective on acceptance and welcoming. And then it's also that the younger generation both doesn't seem to want to engage as much, as well as there's a lot of anecdotal stories and evidence that shows that when the women veterans or LGBT just don't feel like there's a lot of space for them.
Which led me into a question about that, because you made that comment in your presentation that an overarching message or theme that you got in your work was that women and LGBTI veterans didn't feel particularly welcome, and you spoke about cultural competency. The other thing you mentioned, which I think is important, and I'd be interested in your comments, was you also spoke about the experience, the percentage of both women and male veterans who had experience of sexual harassment, sexual assault, those sorts of experiences. And I was looking at a report earlier in the week, I think on the weekend, where what fascinated me was to see the growth in that over the last 10 years. They were reporting US data, and it was the growth in the reporting of those activities. So two things, I think. One is what do you think organizations, whether they be Veterans Affairs, whether they be veteran support agencies or community groups, what are a couple of things, and maybe it's under the theme of cultural competence, what are some of the things that you think they need to be thinking about and perhaps doing to make themselves more attractive based on what you've heard? And then part of that competence, what might be, and from your overview, what might be some of the elements that they need to have in that cultural competence framework that you've seen? And then the third thing is, with this growing rate of, maybe the incident rate's not going up, it's that people feel more comfortable about reporting it, but the fact that we have this thing around this area of sexual assault, sexual harassment, is this an area that they need to develop some competence in to be able to respond, understand the issues, and then respond appropriately to support people?
On the first question of how do organizations make themselves more attractive to these diverse populations, part of it is representation and ability to say that they are welcoming. So we tried to at least monitor on our site visits the amount of representation of women, of minority women, of minority men on posters and other things. I included that brochure on Safe for Sex in this presentation because it was printed in 1985 and doesn't seem to have been updated since, and yet it's still being circulated at the Albany VA Medical Center. So there's that just kind of shocked us at the level of the lack of attention paid to that community, and the fact that it's a lot of information has come forward since 1985, and so we found it a bit galling in some cases. And so part of it is representation that is very clear. And the other part is outreach, and we heard from especially racial ethnic minorities that it's not as simple to say, come to us, that they need a liaison in the community or somebody to speak with who can talk to veterans and address their concerns and show them that the VA can be a place where they can be welcomed and get care. Because especially for older veterans, so this is earlier than post 9/11 cohort, if they had a bad experience in the 90s, they never went back. And that is a huge hurdle for the VA or any organization to get around. And so part of it is, these veterans may never see the poster or see that things have changed or be aware of that because, they had one bad experience and just decided it wasn't for them. We heard from LGBT veterans that they really do appreciate VA representation in Pride parades, and the fact that they show support during Pride months, that just made them feel like it was being normalized. However, one other thing that VA can do is add a screening question. Now that might seem discriminatory because it's asking, but in a provider, with a provider asking, a number of veterans expressed to us a desire to just normalize their status so it doesn't feel like they have to out themselves every single time they go to the doctor, that it's been addressed, that then the provider is aware, and that can then speak to any related health concerns or needs that they may have. So on the cultural competency, there have been attempts to do kind of a secret shopper approach where for MST or other things where the VA red teams itself, and that could certainly be helpful to make sure that every place of interaction for veterans, from the front desk to the provider themselves, are doing the right things and taking the right approach, because there are inconsistencies. However, it's really hard when it's the patients and the other veterans in the space rather than the providers themselves, and that's something the VA is still working towards figuring out is how to encourage respect in their centers. And again, that there's a lot of anecdotal information that shows that veterans, women veterans and LGBT just don't feel comfortable because of other patients rather than providers. So the VA has been working on cultural competency. VSOs are a little lagging behind, and that does seem to be inconsistency across and between posts. And so one of our recommendations was very much hammering on the idea that headquarters needs to really support and facilitate that cultural competency and that welcoming nature of posts around the country. I think I hit all your questions.
Yeah, no, that's good. So maybe it's a more conscious effort by organisations who are working in this space to recognise this as an issue and then take action that's appropriate to understand and develop appropriate responses that make people out of these populations feel welcome. And also I take it from something else you said about where, because of that prior history, there is that suspicion and lack of trust that they don't come back. And we've heard that in some other presentations. And maybe it's about also looking at ways that we've got to engage with them differently to the way we've done business in the past. So
well, and to that point, it's the cultural competency and the engagement in the first place, right? So it's even to reach these populations, you have to understand that maybe they're not. And then we heard this from African American population in New York State, that they have it. Somebody expressed that there's just a different approach to healthcare, and that's something that the VA has not quite understood or responded to.
But I also think it applies in some of the other areas, in those other domains you talked about too, is how do DSOs and others and government agencies around those other domains in the people's lives, so about housing and employment and recognising that often those people, and you mentioned it yourself, face barriers in those areas. So from a personal point of view, I think that the issue that you raised is actually very relevant to anybody working with this population in whatever aspect. I think you've raised a very good issue there. It's about seeing that one size doesn't fit all, and that there are a significant and increasing, as you pointed out, minority that perhaps we have to rethink how we approach them. So Thank you for those observations. We've got a question here that's come in about, you talked about homelessness, and you talked about the work that's been done to reduce homelessness. And so the question is where did the leadership for that come from? Was it driven nationally or by a particular sector? And the second part of the question is, where did the funding come from to support the positive action? And the third part of the question is there separate accommodation for female and LGBT veterans?
So it's a combination of private, public, and nonprofit support that really focused on the homeless veteran population and made a point of bringing it down. There's the point in time count that happens every year that counts every homeless person on the street, and I think it was really recognizing that veterans were a proportion of that population. And because veterans are unique in having a wide variety of support ranging from the VA to the nonprofit sector, that those organizations as well as the federal government made a point of making sure they had access to care. So, as a combination, both in terms of support coming out of the Obama administration as well as funding that kind of was state, local, and national, as well as nonprofit. To the accommodation question, we're talking largely about shelters overall that are not veteran specific, although there are some housing programs and organizations on a regional level that do support veterans getting back on their feet. There is it's a trend nationwide that also then affects veterans, which is that there will be gender specific accommodation. However, that is not always the case, and it really depends on the shelter, and it just varies widely. I know that's maybe an inconclusive answer, but one of the difficulties that we saw was that LGBT, or if it's gender specific housing, that might not always align with how they identify, or if it's, they are identify as gay or lesbian and are, and this largely pertained to homeless men who identified as gay, that they did not feel comfortable in a single gender accommodation. So there's just huge variance there.
Mm. And I think based on some discussions with other colleagues that, you sort of alluded to it too, I think, Emma, it's about really where the leadership comes from. It depends on what happens in that community or that region or that state. It's about who's showing the leadership. And that was one of the things in talking with some folks in California, for example, where in Los Angeles it was the mayor who showed the leadership and brought people together to actually look at broadly the issue of homelessness, and within that the veterans homelessness issue. So,
and New York City certainly tried to lead on that as well, and has really done a lot of work to get to functional zero for homelessness, which is of course inclusive of veterans.
Thank you for that. We've got a couple more questions have come in here. One is did you note any gender difference in the terms of where veterans are located? So rural versus urban, or was it fairly evenly diverse?
Well, in part, it's just the sheer number of veterans tend to be male. So, and because of age and cohort, there are a lot of male veterans that I'd say on the whole, white male veterans, they're more represented in the rural communities. But this does change by state as well as through New York State itself. There are some good maps and graphs that New York State Health Foundation and RAND have done in the past that get down in that question to the county and local level. That we did some of that information, but mostly pulled from past work.
Thanks for that. There's another question here. From your work, did you identify how much has the internet or social media, and the words here, added fuel to the fire of the traditional veteran service organisations' downward trend? So I think it's the question is really, how much is social media allowing individuals or groups to bypass what were the main channels of information? And if that's the case, if that's something that you observed, what do you think is important around how we use those new channels to communicate with minority veterans?
So in past work, what we have seen is, despite post-9/11 veterans not necessarily, joining the new organizations at higher rates, the traditional VSOs still have amazing numbers across service cohort, and they, a lot of post 9/11 veterans still join them. It might not be, preference in terms of community, and there is more pushback on how they operate. However, when it comes to numbers, social media followings is not necessarily indicative of how many people the new organizations help, even if it is how many they can reach in marketing. So, and sometimes those are treated a little bit more closely than we've been comfortable with. When it comes to VSOs have not done a great job of getting online and communicating in as an effective social way as some of the more flexible and newer organizations, and certainly there have been great examples of trying to create and foster community through online chats and groups, and using Facebook, and so it does vary, but it could be a big benefit for representation and making sure that information is getting out there and shared if these organizations leveraged it perhaps to a greater degree.
Thanks for that. We got a comment here from a representative from VA, and it's in response to the person who asked the question, I think, around housing. So I'll just read this out. Veterans are housed based on self-identified gender. For non-binary, they're housed based on preference. And the person said that's for VA facilities, not the community. So hopefully to the person who asked the question about housing, that gives you an extra little dimension.
Well, and to that point, one thing that we struggled with is, in all of these focus groups, we're active listeners. We're not trying to impart information. The VA has done quite a lot of work in recent years and throughout history to support the veteran community. And there is, in terms of cultural competency and awareness training and making sure that folks do have access and are, housed based off of self-identified gender and whatnot. There are a lot of very good things occurring in this space. It's there's a bit of dissonance with what veterans are interpreting or seem to be experiencing themselves, and so there is a communication lag there, or just an exposure lag, and that gets to the point I made earlier on, which is that some veterans just won't know about that progress because they haven't necessarily gone back, and that's then that's unfortunate for them, who, if they could be receiving this care, they just don't know exists. So there's more communication, and a lot of about that good work that is occurring, and so part of what we were trying to get into and recognize was if something like a community liaison or individual who could try to reach different subpopulations would be of a huge assistance in actually getting them understanding the care that they then could receive.
I'd like to go to another area I thought was very interesting in your presentation was about employment and income, and the disparity that you observe in that area. And there was the disparity between women and male veterans, but there was also the disparity between some of the ethnic minorities and women veterans generally and male veterans generally. And you made the comment, which was interesting, that women veterans perform or do better than women in the general population in terms of employment income, and on a par with males who are non-veterans. Why do you think veterans do better in employment if they move into employment? What were some of the things that came out in your research that showed that why they performed better?
Well, first I'll say that we didn't always look at the why, because it was a task itself to try to get into results and findings. So this was more descriptive in terms of the status of minority veterans in New York State and throughout the country, to just really make sure we were disaggregating that information rather than lumping veterans all together. So this report was not so much the background as to why these outcomes exist, but trying to put a pin in that information so that it can be useful, because too often it's buried in larger reports. We do find veteran status is protective, so people who have served in the military have better outcomes across the board of these life domains than their civilian counterparts. So there's an aspect there that that impacts financial stability as well, and it does seem to maybe the why, and when it comes to racial, ethnic, or women minorities is that the veterans also have to return to civilian life that is impacted by structural trends and societal norms, and we see discrepancy in the gender pay gap in the civilian space as well as the veteran space. So to some degree, it follows. There are trends when it comes to how racial ethnic minorities as well, and education or financial attainment. So what the tension we were trying to really look at was, we know veteran status is protective, and then the information that we found was that, that being said, white male veterans still tend to do better than any other minority subpopulation of veteran, as well as a civilian population. So it seemed like, because veteran status was protective, women veterans, for instance, did maybe as well as male non-veterans, but not quite as well as male veterans, if that makes sense.
So I guess a marker for us that we know we've made progress is when women veterans are on a parity to male veterans in employment, right, and income. Yeah. You also mentioned another interesting thing that I'd like you to maybe comment a bit more about, and that was about the job training focus in the existing programs tend to be very much male dominated, male focused. Given what you've heard, what you've seen in this study, what sorts of suggestions would you have for how we need to rethink those programs that not only make them more open and appealing to women veterans, but maybe some of the other minority groups as well?
This was something that women veterans expressed, that, and this is a trend in employment, that while there is a good effort to try to assist veterans with employment after service, it's, can be a little base. So, factory work, or I think there's usually a joke about flipping burgers at McDonald's, and, these veterans have been highly trained and have a variety of skills. So there does seem to be a trend of trying to hire veterans into construction or security work, being personal, guards, and that women veterans just didn't think that was very helpful from a hiring perspective, and that job fairs usually focused on sectors that were just not quite what they wanted to do, and that usually do tend to be fairly male dominated. So it's more of a, that's a private sector impetus, and there are a number of companies that do try to hire veterans and have a broad variety of things that they work on. We've done other work and have a white paper out on veteran employment right now that is separate from this report, for more information on employment and veteran underemployment. But it does seem to be both the transition services that connect veterans with potential employers, as well as what that pull factor from employers themselves. And I've spoken with some of our colleagues in the UK and the corporate sector there, who are thinking about, they know that the majority of veterans tend to be white and male, but that is changing. So how do they then reflect their recruiting efforts accordingly?
So you mentioned the white paper. Is that available for people if they're interested, or
Yes.
is it about to be published?
No, that's out. That was released earlier this year, and that's called Veteran Employment Hurdles to Opportunity, and it's also available on our website.
Thank you. There's another question around this employment topic, and the question is, are veterans specific job development programs more successful when they are gender specific as well? Is that a thing that we need to think about?
For this report specifically, we did not look at that question. However, I think there's good research out that shows that, and marketing speaks to when things are targeted and made more specific for specific groups, then they tend to do better for those individuals.
Then another comment, and the comment is in Los Angeles. This person's obviously in Los Angeles. We are seeing more sector-related veteran service organisations. One of our largest is Veterans in Media and Entertainment. They seem to be more diverse and so have a greater opportunity to connect with a broader spectrum of veterans for research purposes. Did your research, and this is the question component, did your research work with sector-specific VSOs? And the second part is, and are there best practices that can be taken from these organisations?
Best practices, I assume, for sector specific. So we worked with, because we were looking at outreach and we're looking at outcomes. So we worked with chapters and posts for large national level organizations to try to reach out to veterans and use their space. And that was largely due to access as well as impact that those organizations have on veteran lives. We've done a lot of work, again, separately on the Sea of Goodwill and organizations that support veterans. That's, again, available on our website. And, I would say that sector specific, there are a number of organizations that crop up to help with particular issues. The large national level VSOs, often support specific needs that veterans may have, be it financial, housing, or other. And our report, as well as the information that I shared in that one of those final recommendation slides, does have more information on how these organizations can support minority veterans. So, and that was kind of what we touched upon earlier, which is raising awareness about the services that they do have, that they support members with disparate challenges, and using the existing organizational communication platforms to really make sure that they're reaching a wide variety of veterans, and if they're not, expanding those communication platforms further.
Yeah. Well, I guess around that, the comment and then the question where they were talking about that organisation working in the media and entertainment. I guess it's about that community. You addressed this yourself about how do we develop new, not only messaging, but communication channels to people who maybe have tuned out to the current communication channels because of past experience, or anecdotally they've heard stories and therefore they've self-selected out of engaging with those channels. So I guess to your point, it's just another example of seeking a different model of engagement, different form of leadership, and also visibility, as you said, of people from different backgrounds and ethnicities and sexual orientations being visible through these organizations as veterans, and therefore creating that welcoming place, voice opening for people of similar backgrounds who currently aren't engaged to sort of come in and seek assistance or seek advice or seek information.
Absolutely. And I think, you know, business as usual just might not be working because it's not reaching the correct population. And something we hear both in the military space as well as the veteran space is, you know, people vote with their feet. So if they're gone, it's, you know, it's on them. And that doesn't speak to the fact that they just might not be aware, or they may be receptive if somebody reached out to them. So I'd say a lot of these organizations could do a bit more to be more nuanced and flexible in how they're then reaching veterans to help serve.
One other area that you spoke about was this increasing divide in the US, and my sense from talking to people in other countries is it's similar. Divide between the military service and veterans and the general population. In other words, the general population really does not have much of an understanding of the issues and needs of that population, and perhaps without being too fine a point on it, in general, maybe not all that interested anyway. How important do you think, particularly for minority veterans who often go back and you alluded to this, want to blend into the backgrounds of the community in which they are? How important do you think it is for government agencies and veteran support agencies and others who work in the veteran space to be thinking about how we engage with the broader population as a channel for engaging with minority veterans who maybe not going to come through the normal channels but are out there? And the second part of that is then how do we mobilize those parts of the community where they might be hiding in plain sight to support us to engage with veterans, and then to in turn support the veterans within their space?
I'll take a bit of a different angle. I think there's some concern in the sea of goodwill that increasing distance between the public and the military may mean that fundraising is harder, and that this deluge of support that came post 9/11 is, well, maybe not could dry up, but could certainly diminish in quantity as people start focusing on other things and don't have as many personal connections with the space. When it comes to minorities who might want to blend into the background, or who have chosen to disengage, I think there's a bit of a tension between, you know, if a veteran doesn't want to publicly identify as a veteran or engage with services for veterans, they should, you know, it is their right and ability to do so, and those are you know, veterans that organizations or the VA are unlikely to reach and might not need to, because however, we have seen that there are gaps in information, and certainly there's a good amount that could be done to try to step up that communication, and make sure that at least it's out there and easily accessible. There are many complaints about websites, for instance, and in recent work that we did at benefits offered at the state level for veterans, offered through the government, that is, and in state governments, that they're just difficultly worded and hard to find, and very confusing to navigate. And so part of it is not just making sure that any organization or the VA is putting information out there for veterans to find, but also that if found, it makes sense and it's easy to navigate. So might not have answered your question exactly how you thought, but it's part and parcel with making sure that if somebody is interested and decides to Google, that information is readily accessible.
Well, thanks, Emma, for a really interesting presentation today and a great overview of this part of the veteran population and some of the issues that you've identified. Really appreciate that. Thank you for pointing us to those other resources, and hopefully people will go and have a look at your website and look at some of the resources. And at a personal level, I recommend that you do. There are some great resources that have been collected, and some of the work CNAS has done. What I like about it is it comes from that non-partisan point of view, and it looks at the issues from a different perspective to where many of the commentators automatically start from. And I think it's really useful to always go and have a look through what I call a different set of eyes at some of these issues. So I want to commend Emma and her boss, Kayla Williams, and the others at CNAS for the great job that they're doing around this space, and their efforts to reach out not just as a US-based entity, but reach out to colleagues across the Five Eyes network and look at the shared experience and how they can cooperate and collaborate. So thank you, Emma, on behalf of everybody today, for a great presentation. We really appreciate that. To those of you who've joined us today, we thank you for making the time to come, and we trust that you found that very useful, giving you food for thought, and hopefully whet your appetite to want to engage more as we move into this next stage, where we will drill down and look at in a bit more detail the issues around women veterans, our LGBTI veterans, other minorities, and our Indigenous veterans. So thank you, everybody. I hope that you have a wonderful rest of your day, and we look forward to having you join us when the series will be taking a break now for a couple of weeks, and we'll recommence in early May with Dr. Daniel Perkins, and we'll be sending out invitations to Daniel's presentation after Easter. So thank you, everybody. Take care, and we look forward to having you join us when next we convene. And thank you to you, Emma.
Thanks, Robert.
Thank you.